Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Your kneecap, or patella, is a small bone at the front of your knee, acting as both a shield and a pulley for your leg muscles. It glides in a groove at the end of your thigh bone, helping your quadriceps straighten your leg efficiently. When the patella slips out of this groove, a dislocation, it's sudden, painful, and the knee can't function properly. The kneecap usually moves to the outside, causing a visible bulge and making it nearly impossible to straighten or bend your leg. This injury is common in young, active people, especially athletes, but can also happen from a simple twist or fall. Some people are more prone due to bone shape or loose ligaments. There's also subluxation, where the kneecap partially slips out but returns on its own, still painful and a sign of instability. Both dislocation and subluxation mean the patella isn't tracking right and need attention to prevent further damage. Recognizing these problems early is key to proper treatment. Ignoring them can lead to chronic knee issues and repeated injuries. Patella dislocations come in three main types: acute, recurrent, and habitual. Acute dislocation is a one-time event, usually from trauma or a sudden twist. Think a footballer changing direction or a dancer landing awkwardly. Recurrent dislocation happens when the kneecap keeps slipping out, often because the supporting ligament, the MPFL, is stretched or torn after the first injury. Even simple movements can trigger it once the ligament is damaged. Habitual dislocation is rare and usually due to anatomical issues like a shallow groove or muscle imbalances, causing the kneecap to dislocate every time the knee bends. Acute is about trauma, recurrent is about instability, and habitual is about bone structure. Knowing which type you have is crucial for treatment. Trauma, ligament damage, and bone shape all play a role. Each type needs a different approach to prevent long-term problems. Understanding the cause helps doctors plan the best treatment. Early diagnosis can make a big difference in recovery. A patella dislocation is hard to miss. Sudden, severe pain, apop sensation, and a visibly deformed knee with the kneecap off to the side. The knee often swells quickly, making it stiff and tender, and you can't put weight on it. Muscle spasms may lock the knee in a bent position. With recurrent or habitual dislocations, pain may be less intense, but instability and the fear of the knee giving way become constant worries. Some people learn to pop the kneecap back themselves, but the joint remains unstable. Grinding or catching sensations can mean cartilage or bone damage. Persistent ache and instability signal the need for medical attention. Ignoring these signs risks long-term knee problems. Diagnosis starts with your story: how the injury happened, what you felt, and if it's happened before. Doctors look for a displaced kneecap and manage pain before gently guiding it back into place, a process called reduction. Immediate relief follows, but the knee stays sore and swollen. After reduction, doctors check for ligament damage and instability, often using the patellar apprehension test. X-rays confirm the kneecap's position and check for fractures or bone fragments. If more detail is needed, an MRI shows ligament tears, cartilage damage, and hidden injuries. MRI is especially useful for spotting MPFL tears, the most common soft tissue injury in dislocations. Imaging helps doctors decide if surgery is needed or if rehab alone will work. Quick, accurate diagnosis is key to preventing future dislocations. The right tests guide the best treatment plan. First-time dislocations without major fractures are usually treated without surgery. The Rice method, rest, ice, compression, elevation, reduces pain and swelling, often with a knee brace for support. Once swelling subsides, physiotherapy is crucial to strengthen the quadriceps, especially the VMO muscle, and restore knee stability. Rehab also improves flexibility and balance, lowering the risk of repeat injuries. Surgery is needed if there's a large fracture, loose fragments, or if dislocations keep happening despite good rehab. The most common surgery is MPFL reconstruction, using a tendon graft to stabilize the kneecap. Sometimes, bone realignment is required for severe anatomical issues. Recovery from surgery involves months of physiotherapy, but can restore confidence and prevent future dislocations. Early targeted treatment gives the best chance for a strong, stable knee. UMCC, your ultimate medical consultant connectors.